Well, good morning. I am pleased to be joined by North Carolina Secretary of Health and Human Services, Dr. Aldana Vosch, as well as the Deputy Secretary for Mental Health, Mr. David Richard. Thank you so much for being here, both of you. Let's start out by talking about an issue that has gotten a lot of discussion in Raleigh lately, and that is Medicaid. It, of course, takes up a large portion of the state budget, and there has been some talk about moving Medicaid from your department and putting it elsewhere in state government, with the idea being that that could make the program perhaps more efficient and keep costs down. You have opposed that, Secretary. Why?
That is something that really I do not see why that would even be entertained. The Department of Health and Human Services has very well-known chronic issues and challenges, as you are aware of, through the many years. But through the last 20 months that we have been able to have the honor of leading the department, there have been such structural reorganization done to stabilize the department, to face it forward, that at this point in time, to redirect the senior leadership team away from trying to stabilize the chronic problems, it really doesn't pass the common sense test. People say, well, my goodness, it's been broken 20 years before, and so if we just put it someplace else, it'll be fixed. It doesn't matter where you would put a car if it has a broken engine, which garage or what color you would paint the car. You have to fix the engine to make it work. And that's what we've been doing.
Mr. Richard, the Secretary mentioned the need to take care of the whole person, and I know that includes not only physical health but also mental and behavioral health. I know that's the part where you come in. So from your perspective, if Medicaid were to be moved from Health and Human Services and put elsewhere in state government, how would that affect your ability to provide mental health services?
Well, our system is built upon a collaborative effort, as she mentioned, between how we use state dollars and how we use Medicaid funds. In fact, you know that we run our behavioral health system through a managed care organizations across the state, and it is part Medicaid, part state money that's in that, and we manage that collectively. I think if we tear it apart, if we bring Medicaid out, one is we're going to have to recreate the same kind of relationships in a different agency. So now we've developed those relationships. Dr. Cummings, who's the Medicaid director, and I speak almost every day to talk about the behavioral health system we have. We meet once a week with the Secretary collectively to oversee what's happening in the behavioral health world. And we can work together because we have that kind of relationship.
So on the one hand, we're hearing about potential restructuring of Medicaid at the state level. On the other hand, we know there is some discussion about potentially expanding Medicaid after the state decided not to do that initially as part of the Affordable Care Act. Secretary, what can you tell us about the work that's being done or the considerations being made for expanding the program?
Well, thank you for that question. The issue of Medicaid expansion obviously does not rest with the decision at the department level. There are many people that will have to come to an agreement about that direction for the state. But when we arrived the 20 months ago, as you know, the department had chronic problems and was not able to even address the issue of possible Medicaid expansion, meaning providing more Medicaid services for a greater amount of citizens. At this point in time, after the 20 months, we have stabilized and reorganized the Department of Health and Human Services, inclusive of the path we're on internally in realigning the Division of Medical Assistance, Medicaid. And it is time for us, we are finally able to look at the information we need to gather the data to be able to present to the governor in reference to possible proposing a decision of Medicaid expansion. Medicaid expansion is not just giving someone an insurance card, because the insurance card alone is not going to make anyone healthier. You have to prepare the state on all fronts, such as, are our county departments of social service equipped to handle that extra load of another 300, 400, possibly more thousands of people into the system? We certainly were not able to do that last year. We struggled with the systems and with the counties in order to stabilize it, improve it, and make it better.
Secretary Vosh, earlier this week, I covered your testimony before lawmakers. They were asking you about the state's medical examiner system,
Yes.
which has come under fire recently. You outlined a list of recommendations that would include building a regional autopsy facility here in Wilmington. How does that play into the direction that you want to go to try to fix this system?
Well, thank you. That's a very important question. Through the years, the issue of the Office of Chief Medical Examiner has had many, many challenges, and this is for many years. Way back at the beginning of 2000 and 2001, already the state had identified problems and had different reports, and through the years, unfortunately, it was not funded. At the same time as the need expanded, our population is expanding, technology and our abilities at the state lab with different methods of getting to different results has expanded. So we have a greater need in the state with each year. A decision has to be made to stabilize, correct the chronic problems, and face forward and expand. One of the recommendations that we have presented is, besides our 3 regional centers that we must stabilize, we also need additional centers, and one of the ones that we'll be proposing is in the Wilmington area.
Thank you so much for your time. There are so many other things that we could ask you about. Your department touches so many people, but we really appreciate you being here, and thank you for the work that you're doing. Bailey, let's go back to you. All right.